It's okay to be ignorant on something because you just don't know all the facts or you haven't been taught yet. But being stupid, really, that I know it's not a nice word, and I have been stupid in the past, but I'm getting old and grumpy. And so when I hear stupid, I kind of want to call it out. And since it is Therapeutic Thursday, I want to talk about that. And I have the past 30 years have been specializing in chiropractic, physical therapy, spinal biomechanics. I know my stuff about facet syndrome, spinal degeneration, disc herniations, prolapses, bulges. I know my stuff. And I hear things that are stupid. And so I want to kind of give you like a heads up here. I had a patient who came in who just had just an awful weekend where having pain shooting in the neck, down the arm, causing swelling in the facet joints, and went to the MD, got some x-rays, and said that the x-rays showed that there was no disc anymore, that was the problem. It was bone on bone. Now, I've been treating this patient for a while, and I noticed that the patient got better underneath my care, but had this major episode. So I got alarmed. So I took an x-ray to see where this bone on bone was. And I had my office manager, who's been with me for about 16 years. I put the x-ray up and I said, show me where the disc is gone now and where it's bone on bone, to my office manager. And she said, well, Dr. Pat, I can't see that because it looks like that all the discs are there. There is one that has degeneration. And I said, well, good for you. She read the x-ray. So I brought the patient in and I said, which one is bone on bone? And they didn't know, of course. And because it's not there, okay? There is discs in there. And so I'm not sure what doctors are now looking at because it's driving me crazy. And I hear this way too often. And I know I'm a chiropractor and I'm not a medical doctor, but I do specialize in taking care of disc problems. And here's another little tidbit. And I know it sounds like I'm an angry, crotchety old guy now, but I just want you, the public, to be aware of this and to share this video with others. Discs get blamed for so many things. And there are MRIs that show people have full-blown disc herniations and they have no pain. And then there are people who have all kinds of pain and they take MRIs and there's no disc herniation. So we're giving too much credence to the disc. And let me tell you this, if it hurts like the dickens, discs don't have any nociceptors attached to them. Nociceptors are the pain receptors. That is the only way that your brain can sense pain. So you have to have a nociceptor. There are no nociceptors in the discs. I'm not making this stuff up, folks. Okay, so when a disc is blown and herniated, what it usually does is it puts incredible pressure and pain on a facet joint, which a facet joint is like a knuckle. And when you look at your knuckles, if you've got a knuckle that's really swollen, you can diagnose yourself and say, I got a swollen knuckle and that hurts. Well, when I feel patients' necks and I feel a facet joint in the neck that is 5 times bigger than it should be, and I push on it and they go, ouch, and somebody says that it's a disc problem, it's not. It's a swollen facet joint, and it is hurting terribly because facet joints are loaded with nociceptors. I know this is probably too much information, but so many of you are signing up to have disc surgeries and thinking I'm going to go get it corrected, and it is the wrong thing to do. That is stupid, and I'm sorry to be so blunt. Now, have I sent patients over the years to have disc surgeries? Yes, I have, because sometimes it is so unstable that you can't fix it biomechanically. So, here's what you need to do. If you are having full-blown pain down your arm, it is most likely coming from a facet joint. And if you get somebody who specializes in spinal biomechanics, physical therapist, chiropractor, even using massage therapy, ice, and any anti-inflammatories, you can get past this ungodly pain. You can. Just because you're in so much pain does not mean that you need to have disc surgery. They usually don't hurt that bad because they don't have nociceptors. That is just a fact. So I hope you learned something. I know it took a little bit of time, but please share this with people so that they don't sign up and have these unnecessarily neck surgeries or back surgeries. We know as chiropractors, we know the difference between a facet joint problem and a disc problem, and we know how to fix them. We know how to fix both of them. And here's another thing that gets me up in the morning in a cranky mood is that a lot of doctors and specialists out there say that chiropractors, if you have a disc herniation, can make it worse. False, false, false. There is no scientific evidence ever. Any of these research projects that have ever looked into the fact that do chiropractic adjustments cause disc problems, and if you have a disc problem, should you avoid a chiropractor? Guess what? 100% of the time say that chiropractic adjustments reduce the pressure around the disc. They reduce the pressure around the disc. If your disc is herniated, it has extra pressure around it. It's herniating. Chiropractic adjustments reduce pressure around the disc. That's a medical fact, medical science. It's not what the rumors are out there. I have in 30 years never caused a disc herniation, and I use some pretty aggressive techniques because chiropractic adjustments have been proven in science to reduce pressure on the discs. That's a fact. Okay, I'm going to go back to being really nice again because most people think I'm a really nice doctor. I hope you learned something, and if you need to get in touch or you have any questions, you can always reach out to us if you're in the Salem, Virginia area at Kennedy Health and Wellness. I'm Dr. Pat, and I approve this message.